Okay, so it'd be really helpful if you could tell us a little bit about genetics and family planning for people with EPP.
Yeah, so that is something that has definitely advanced a lot. It's got a much better in the last 15-ish years. So overall, if you've got EPP, the chances of passing it on to a child of yours are very low. Actually, overall, it's about a chance of 1 in 40. Occasionally, somebody with EPP will have a child who's also got EPP. It does happen, and some of you may be in that situation, but it's not common overall. That's all we could say 20 years ago. I think what we can say now is a lot better than that. So if you say, yes, but how do I know whether we're likely to be one of those couples who there is a quite a high risk, we may well have a child with EPP, or we definitely won't. And that's what people want to know. And I think we can do that much better than we used to be able to. So the first thing is there are two different ways in which you can inherit EPP. There's the standard common genetic inheritance, which is the one which is due to the ferrochelatase gene being damaged, and then there's what people sometimes call X-linked dominant, XLD PP, X-linked dominant protoporphyria, which is also EPP. It's just that it's a different gene causing the same problem. So the XLDPP, the X-linked dominant protoporphyria, is rare. And it's much rarer than and I don't know how much rarer, but a lot rarer than there are clearly hundreds of people with EPP overall in the UK, and there's actually a very small number of families, as far as we know, who've got XLDPP, X-linked dominant protoporphyria. For those people, if you have X-linked dominant protoporphyria, there's a very high chance of passing it to a child. It's actually 50% chance. Every child you have, and it doesn't matter who you marry, there's a 50% chance of the child of a person with X-linked dominant protoporphyria, also the child having, so it can run through families and often does, but that's very rare. The normal common type of EPP, which almost everybody with EPP has, it depends who you marry, because the person who has EPP can pass on the damaged gene to their child. They may or may not. It's a 50% chance. It's a 1 in 2 chance they pass it on to a child, but that gene is not enough to give EPP to the child unless the gene from the other parent for ferrochelatase is what I always call the normal but feeble version of the gene. Because what happens is that we all have two ferrochelatase genes, one from my mum and one from my dad. We all have that. And the ferrochelatase enzyme, and that's the thing that is the problem in EPP when it doesn't work. The ferrochelatase enzyme is made by both those genes. So if a person with EPP passes on a bad gene to the child, then the child is relying on the other gene from the other parent who's not got EPP, not from an EPP family, to compensate. And because they're running on one gene, because the one from the EPP parent may not be functioning at all, it's damaged. And there happen to be 2 versions of the normal ferrochelatase gene that are around. So 90% of people just have what's called the high expression version of the ferrochelatase gene, and that's good and strong and produces lots of ferrochelatase. But 10% of people, so in Britain that's going to be 5-6 million people, they just happen to carry a normal gene, but which is called the low expression version of the gene, and it's fine. It's fine normally. It doesn't cause any problems at all. But if it combines with the damaged EPP gene, then the combination of the normal but feeble gene from one parent and the badly damaged gene from the EPP parent is enough to give EPP to the child. So what that means is, that's a long way of saying that if somebody with EPP, normal EPP, not talking about XLDPP, normal standard EPP, has marries, has a partner, then we test the partner, and we basically want to know, is that partner the 1 in 10 normal healthy people who happen to have the feeble version of the normal gene, or are they the 9 in 10 who have the strong normal version? If it's a strong normal version, that couple are not going to have a child with EPP. If the person with EPP marries somebody who happens to be the 1 in 10 people, the 10% of the healthy normal people who carry the normal but feeble version of the gene, the low expression version, then for each of their children, there's about a 1 in 4 chance of them having EPP. So the children may not have EPP, but they might. And we can do that test. We can test in the partner, and we can also do the test for XL-DPP. So all the testing is available if you want it. Of course, the testing is, sorry to interrupt you.
No, you're all right.
The testing is something that in some other diseases, it's obviously done, in some other diseases that are, perhaps, other genetic diseases that may be, very, very dangerous at a very young age to a child, those sorts of diseases, then it can be done with a view to, maybe one can sort of terminate a pregnancy if there's a real problem with that. Now that isn't an issue in EPP. It's a horrible thing to have, but nobody would suggest anything like that. So we then have the thing of, when we do the tests, I always sort of think it's worth thinking, now given that it's not going to change anything, we're not going to change what we do, we're still going to have children, then we wouldn't dream of changing the course of a pregnancy because of the test results. Are we just producing a lot of worry for ourselves? Because having genetic testing is sort of worrying and worrying sort of thing to have done. There's lots of questions and there's lots of possibilities, and it does make people anxious, particularly during a pregnancy, which really should be a nice time. So I think it's always worth, before you go for those tests, checking why you want the test. Some people just say, I just want to know. I've had one couple say, actually, if there's a possibility of having children with EPP, I think we're not sure whether we want children or we won't have children if that's a possibility. So there are a few people where it's clear cut, but there are a lot of people who sort of, there have been some people I've met who've had the testing done, and then because they think, oh great, it's going to show us that we're fine. And it usually does. Actually, 9 times out of 10 it does. And 1 time out of 10 it shows that you might have a child with EPP. And then it's all just very hard for them, and it's caused anxiety and it hasn't achieved anything. So before going for those tests, always think, why am I doing it? And, because it's more grueling than you think.
Yeah. And I'm assuming genetic counselling is available for those people who want to consider that.
Absolutely.
Yeah. Excellent. Thank you.